All right. Well, I see we have folks joining in. We are a couple minutes past the top of the hour, so we will go ahead and get started. Again, Zenobia Godschalk here. I run communications at Swirlds Labs for the Hedera ecosystem. But more importantly, today I am joined by Jim Nasr, who is the CEO and founder at Acoer. Jim is a well-known and very well-respected technologist in the healthcare and information space. He was formerly the chief software architect at the CDC. For those not in the US, that's the Centers for Disease Control. And he has a long history of building innovative products that help bring trust to our healthcare system, which very much needs that. So, Jim, I have given a very short bio on you, but I think to kick us off, I think our audience would love to hear a little bit more about your background and how you came to where you are today with Acoer.
I appreciate that, Zenobia. Good to see you again, as always. And yeah, happy to connect with the Hedera community. Really, my background is a I would say technologist by profession. I've been in the technology space for too long time. Built certainly the last 15 years or so, a lot of work around open source and open technologies. That's very much my mindset, Acoer's mindset. As you mentioned, at the CDC for a couple of years, and I was fortunate to be involved in what became or labeled as Open CDC, but really a large-scale effort to think about building reusable technologies, modern technologies, API-based technologies that reduce redundancy, make things really more accountable, more efficient. Yeah, as many of you guys, I know you know, Zenobia, in the US, we spend almost 20% of the gross domestic product in healthcare. That is a very, very large number. And to give you a frame of perspective, in the US, $1 trillion per year is wasted, just wasted in all kinds of ways in healthcare. Administrative costs, many redundant processes and bureaucracy, and then so many things. It almost just baffles the mind, and that drives me. That drives a lot of what we do. But really, the thing with healthcare, I think this is the poignant angle for us, is that it is about us as individuals. It's not just aggregate numbers and economic impact. It's about Jim and Zenobia and Isam and Mance and Lehman, every one of us individually, our families collectively. Unfortunately, we saw with COVID just recently, 1.1 million, I think, have died in the US, according to WHO. Over 100 million cases. And so much of that was so preventable. And a lot of it, unfortunately, actually comes down to things that seem garden variety, or at least, on surface, such as getting good information, trustworthy information, sharing it in the right way, timely way, and then making decisions on it. And it seems somewhat trivial, especially when you look at, like for instance, the finance industry, where that's been happening in this efficient market for decades. And you would think, well, if you're spending 10 times the amount of money in healthcare, surely you get at least as good in terms of results, and that's exactly not the case. So that's really the background. And Acoer, we're a software development company. We're very much believe that blockchain distributed technologies can be really a plumbing. I think of it as an abstraction, but plumbing to building technologies that functionally make sense, contextually make sense, but also really impute computational trust, where you're getting this trust factor built in, and you don't have to trust people like myself. You trust actually these highly proven kind of cryptographic methods and computational encryption methods and things like this that people like Lehman and many others have worked on for decades. And that's really the idea. It's removing intermediaries and having to rely on just one person, whether or not they're good actors. So that's the way we're motivated, and knock on wood, we're continuing to make progress in this area.
Well, fantastic. Like you said, this is an area that touches all of our lives. A lot of times we don't understand what is going on in the background. And, quite frankly, most consumers shouldn't have to. But we do understand these ideas of, our data, being able to have trust in these healthcare systems. So I am personally looking forward to having you share a little bit more about what you all are doing. And I'll let you take it away.
That sounds good. I have a few slides prepared and a little demo, and I'm sure we'll get back to chatting a little bit. So let me share my screen. Okie dokie. Zoom panel is getting away. Okay. Can you see my screen okay?
Yes, we can.
All right, excellent. So really, I guess the focus for this conversation is about how we're working to improve public health reporting, which is really, really important. I mentioned the COVID problem, and there were so many breakdowns in public health reporting, and not necessarily at the national level, really even within localities, within counties even, and states, and then all the way to the federal level and back. And then really our kind of focus is very much using Hedera, but also specifically Hedera Consensus Service, which we see honestly as the most innovative service that Hedera has built. I mean, Hedera has many innovative things and really incredible utility as a foundation to build things from. But HCS specifically really is a kind of an intersection of real value as well as real functionality and kind of richness, and we hopefully will demonstrate a little bit. So just a little bit of preamble about like, why do we care about this? What's the point? The healthcare industry should, at least in the US, should look like the silhouette on the left, very much in perfect shape, really good shape, with the amount of money that's put in. If that's not just money, but also frankly really expertise, dedication, people with a lot of strengths that are practitioners in the space. But sadly, what we actually see, the results, when you look at the actual results, the return on investment, if you like, just in a financial way, but also in many other ways, it actually looks like this old kind of crookedy person on the right, and that's just like weird, but also it's really disturbing. And there's so many data points to back that up. I'm not going to itemize that right now, but I encourage you guys to look into it. I'm not making this up. And so that's one of the reasons that we care. That there is definitely a strong why. And I think you always need to have some rationale and purpose in what you're doing. And this is ours. So another data point, and this is, again, not something that I've made up. This is widely known, certainly in the clinical research space. So most of us, I think, are aware, certainly in technology, are aware of Moore's Law, where technology is getting cheaper and faster. And really many companies, many investors, many startups are relying on this Moore's Law to get a return on investment on capital expenditure, because that infrastructure you're building will yield to better results, faster results, improving productivity. That's the red line. The blue line is the literal reverse of Moore, the so-called EROM. And that is what is evidenced over many decades now in clinical research, where the returns on clinical research are getting proportionally or disproportionately worse. And you can see an exact opposite to Moore, where you're spending more time, more money with less results, in that. And there's this so-called better than the Beatles problem in clinical research, where some drugs and compounds, the motivation really is to improve on the Beatles, which is like the best band of all time, and the reason for that is you have these patent laws, where you get to milk these compounds for 5 to 10 years. And there's this real motivation to think IP, and how do you squeeze every dollar out of that? And again, I won't get into this. That's a whole conversation, maybe for another day. But these are well-known facts. The thing that is optimistic, though, to me is this area in the middle, where I feel like, and I don't feel like there's evidence of this. And again, COVID was a good example. How over a course of a year or less, many organizations, albeit heavily subsidized by governments, let's not forget that, came together and used massive breadth of data from wearables, from patients, from all kinds of different places, machine learning, and really kind of very, very quickly, relatively speaking, came up with great results. So we see that as a pattern. We see that these kind of new technologies, IoTs, wearables, distributed ledgers, kind of cryptography in general, all of these can be part of this, if you like, hopefully reversal of this EROMs problem. And that's really kind of where we see ourselves, because, there's really no reason why it should be this way. It is this way, but it shouldn't be. But why? That's a good question. So moving on, this is our visions, Acoers. We really we're here to build accountable, modern healthcare systems. Focus today is public health, and that's really the bulk of our, if you like, energy and what we build ourselves. However, we also have a platform that we have built. We call it the Acoer platform, that's used for accelerating our client solutions and other solutions, specifically in clinical research and the like as well. But anyway, this is really our thinking is, can we build things that are relevant? Are they going to be used by the actual users, not their intermediaries, not, and that's a big problem in healthcare, where there are systems that are built, but you need to have an army of consultants, to make them work. That's not our vision. It needs to work literally, but by the end user. So in our case, in public health, is, for instance, the chief medical officer, in the state of Alabama, or forensic pathologists, epidemiologists. These people really need their information without having to go through analysts or DBAs and things like that. Is it usable? If it's not usable, it doesn't really matter, because nobody's going to adopt it. We're big on taking data. We do a lot of work with complex data and proprietary data and data siloed. And our whole thinking is, can we make it visual? Can we make it intuitive and easy to use by the end user? Certainly security, that's critical. It's at the very core of anything to do with healthcare, public health, clinical research. There's all kinds of compliance, such as HIPAA here for patient privacy in the US, and general data protection regulations in Europe, the California Consumer Protection Act, CCPA, in California, and so on and so forth, and for good reason. So it needs to be that. We're, again, and this is where Hedera comes in, we're really big on this idea of authenticity of data. Yes, is it secure? Great, that's fine, but is it authentic? Is it the latest version? Can you very clearly, very quickly, really in real time, tell who touched what when, were they supposed to? Is there transparency in that? And by the way, there's this notion that there is a disconnect or kind of a oxymoron between being transparent and private, and that really isn't the case. You can have privacy preserved data that is anchored or referenced to with an encrypted payload on a public ledger, which is exactly what we do. So, I hear that a lot from people. Well, we have health data, and so therefore, we cannot possibly put it on a blockchain. And that really is kind of a reductive way of thinking about this. Interoperable, without doubt. No one company, and certainly that's not our intention, or we're foolish enough to think that we could do this, can be like the center for every kind of healthcare data, and not even like the EHRs like Epic or Cerner and things like that. In fact, should be the exact opposite, which is you curate and retrieve data from wherever it happens to be, and you create value, whether it's through machine learning or visualization, or even just sharing on an app. And that's our vision. Interoperability is really, really important. Taking proprietary data, making machine readable is really important. And then all of these really kind of leads to this idea of easy adoption. If you can't adopt it, if it's not low cost, if the cost is outside the context of value, then it's not going to work, and you really have to kind of be honest with yourself. And one of the many reasons why we like Hedera is the fact that we can embed it within our systems without making a line item out of it. And that may seem, somewhat kind of trivial, but really it isn't. It's doing these things and doing it in a way that is abstracted and built in our world is very important, because we don't go and talk to for instance, chief information officers or CTOs or CEOs within healthcare, and our first line is not about using blockchain to do this, that, or the other. It's very much this idea that we're compliant and secure and private and things like that. All right, so specifically driving innovation, public health, why? I think I mentioned some of this already, and some of this is quite intuitive. It's a known issue, has been known for a long time, continues to be a problem. Data is siloed. There's definitely need for compliance and jurisdictional reporting. Dr. Walensky from the CDC, I think it was about this time last year, actually went out there and publicly stated this. I'm not making anything up, but this idea that effectively it was a mea culpa for the CDC and federal government to many degrees, that a lot of things broke during COVID, and there were very, very high repercussions and real human costs. So, again, literally her quote was that there is a need to improve the federal government and CDC's systems around accountability, collaboration, communication, timeliness. I mean, to me, all of those adjectives are direct reasons for why we are doing what we're doing, and why technologies such as Hedera and Hedera Consensus Service actually are really purposeful and really direct fit for purpose for what we're doing. So what are we doing about this? I mentioned the platform, it's very much this set of services as well as applications we've built that are modern, that de-silo data, take proprietary, as example, HL7 data, and make it JSON and machine readable, yet privacy preserving, secure. It's production. We have a number of clients that they use it, and we're continuing to kind of get that adoption. Now that finally this infrastructure is in place, and there's evidence that it's actually working, and it's not just perspective or wishful thinking. There's real evidence of it. There are real clients, real data. So what we're going to focus on today, is this technology, our own application called Health Data Explorer, which specifically is built around public health, and the example I'm going to use today is around mortality and substance abuse reporting. But really, it's very much built working with subject matter experts, in this case, forensic pathologists and epidemiologists. So that's really our secret sauce, actually working with these professionals, not trying to conjure things up as technologists. That really isn't going to work in our space. We need to work directly with the actual experts, the functional experts, and the real value comes when you collaborate in this way, as opposed to try and build things and hope that somehow it's going to fit into somebody's kind of vision. It just doesn't work that way. You have to really understand what you're doing. And then I mentioned this idea of data abstraction, rather data authenticity through abstracting Hedera. That is core to our DNA and how we work. All right, so I often make this analogy when I'm speaking about this kind of stuff publicly, that we're very much building, if you like, what you're going to see in your kitchen or in your bathroom, which is, like the water that's coming through, and is it, do you get the right temperature? Is it the right pressure? Is your laundry, is your washing machine working the way it's supposed to? And the faucet, and when you turn the faucet, does the water come? The fridge, and so on and so forth. Very much that's the experience we're trying to kind of get to, which is very intuitive to an actual user, in this case, somebody who's using the kitchen. But we all know that behind the scenes, if we dug up the plumbing, if you dug up the tiling, there's a lot of plumbing going on. There's a heater, and there are all kinds of pipes, and but nobody does or needs to go and dig underneath the kitchen and take out the pipes to figure out if the water is flowing the way it's supposed to. That doesn't make any sense. You more or less trust the engineers and the builders build it correctly, and what you really care about is are you getting your water the way it's supposed to? So we very much look at blockchain as plumbing, and very much Hedera, as example, specifically Hedera as plumbing that we really trust, and we're building on it, and we see it as a way to, like I mentioned, impute computational trust. So you're getting in real time, you're getting something that through cryptography can be trusted, and there's all kinds of evidence, literally 30 plus years of evidence when it comes to, as example, the ABFT, the asynchronous Byzantine fault tolerance consensus algorithm, and many other things have been built and tested and retested many times over. And certainly these days, with Hedera being open in an open source project and in open source, this concept of many eyes make bugs shallow. This is all really part of the trust mechanism that we rely on. And again, it's been proven to really work. So we focus on the things that matter to our users. So moving on. So I mentioned a lot about why Hedera. I think this is a slide that I've used many times and evolved over the course of time, but there's all kinds of reasons. There is a reason, though, why economic viability is first here, and that is really the rubber hits the road, from our perspective. Because if it's not economically viable, if the cost cannot be abstracted and absorbing what we're building, our platform, if the pricing is variable and we cannot predict it, honestly, everything else is just theoretical. It's not something we're going to be able to use. And that's really kind of core to the way we think is, can we do all this stuff and really not making noise about it? So Hedera just works. We're manifesting Lehman in everything we're doing, but we don't need to bring Lehman into every conversation. And I'm of course, Dr. Bird is, he is an amazing, human and inventor of all this, but we don't want to go and every single conversation bring up, why he is so amazing. We just want to leverage all this great work that's been done. And that's really, really important. This idea that we can absorb it financially and put it into our systems without making a fuss out of it. The real-time performance is critical. And you'll see this with our system right now. Things happen as we speak. And that's critical to the way we think. We don't want to wait. We don't want to batch transactions. We don't want to send reports after the fact, all of which can be done. We can do. But we'd much rather make it on demand. So if somebody wants on demand to say, hey, show your homework, we can do that. And that's really, we find that to be a really kind of a refreshing way of working in healthcare and public health, vis-a-vis almost every other system that's out there. And we like that because that's showing accountability. There are all kinds of platform services. We're going to focus on Hedera Consensus Service today, which we just, like I mentioned before, we really like. Hedera is highly scalable, thousands of transactions. I think the highest peak I've seen is about 2,000 TPS transactions per second, but certainly with the sharding, it could be unlimited. And so we love that because we don't have to worry about, when I mentioned about building anti-fragile systems, we don't have to worry about building additional things to make Hedera scalable. We just worry about, for instance, the decentralized distribution of our nodes and our own services and using Kubernetes correctly and things like this, as opposed to also worry about scaling Hedera. And that's a really big thing to us. And this is where I feel like many times the L2s, the layer 2 solutions break down. One, because they're an intermediary to an L1, but also there's significant, like in our minds, there's significant reasons to have to do additional plumbing to make them scale in the way we want to for our applications, and we'd rather not do it. And many reasons why Hedera makes sense. Certainly sustainability, we care, about our environment, we care about these things being sustainable and not just over a course of a year or two, but really many decades. And again, we love that. I mentioned ABFT and other core characteristics of the network. And then last but not least, in fact, I would say right after economic viability, this is the second thing that we bring up, is the fact that there are 29 organizations growing to 39, of highly reputable, globally recognized organizations. And more now, I think, showing that they have a skin in the game. I think just recently we saw the IBM Boeing, kind of hip announcement and Google. Simon was out there, last month speaking on Spaces, with the Brandon. So it's good to see them. It's good to see them step up. It's good to see them, show that they actually care, because that is a massive selling point for Hedera. And we think, again, when we're trying to make this like why Hedera, we certainly talk about it. It is, these companies make a lot of sense. Anyway,
And
moving
Jim,
on. Yeah.
Jim, I have a question from the audience, which I think I don't want to break your flow, but I think it applies to that slide that you just had, which is, how does this technology align with regulatory requirements for compliance and transparency?
Yeah, that's a very good question. So again, I think when it comes to compliance and regulatory reporting and things like this, there are multiple things you have to consider. So it would be a little bit caricature to say that, well, by using Hedera, that we're going to meet that requirement, right? Because, for instance, HIPAA, there are a lot of things we're doing, quote, off the chain to be HIPAA compliant. And the security, the physical security, the monitoring, the digital tracking of application transactions, the logging, et cetera, et cetera, et cetera. All of those things need to be done with or without Hedera. What I would say is when it comes to regulatory, I guess, nuance and regulatory kind of forward thinking, this idea of transparency is still really aspirational. So they're not really asking for it. They're intimating it, but it's not like it's a hard requirement. I think this is where the innovation is really coming in place, which is companies like us and a few others, and of course many in the Hedera community, actually making this real and saying, look, this is how we're showing that we're compliant. So you don't need to do, a very frictiony, millions of dollars worth of e-discovery years after the fact to show compliance, and that literally is the case right now. You could do it in real time. You could do it as you go. You could do it on demand. So that's it. I would say is Hedera is really ideally designed to be part of your stack, but you can't think that the regulatory compliance is going to be just a factorial of Hedera. There's more to it. Hopefully that answers the question.
All right, thank you.
No
we will do more questions at the end.
Yeah, no doubt. All right, so Hedera Consensus Service specifically, again, we love it. I think I've publicly said this many times that we think is the best thing that Hedera's ever brought out, and it's been around since, I want to say, 2019. So and we have really been just enamored with it and used it extensively since that time. In this case, what I'm showing you with the public health reporting are the things we're doing in this context, but we've also used it with RiseHash as example to create non-fungible tokens. This is even before HCS was out, but we think NFTs can be used with Hedera Consensus Service, at least in the way we work, where it's used as a means of proving uniqueness and a unique anchor. So you don't necessarily need to use the token service for doing that. But regardless, what we do with it is this. First and foremost, this idea that we can do things off the chain that's privacy preserving. I think this is Lehman's AppNet concept. Yet have a means for discrete public transparency, not necessarily for every transaction, though honestly, most of what we do, it is every transaction. But this idea of showing public transparency and doing things off the chain, this idea of verifiable timestamps, our technology is called data stamps, but it's really this concept that we can cryptographically prove what we're saying. Of course, fairness and ordering, that's, it's funny, very few people seem to even bring this up these days, but really from day one, Lehman's had it there, and it turns out that most other blockchains and DLTs don't offer this. And there is really, especially when you're trying to show flow of transactions. For instance, consent. Consent is a good example, where a patient consents, but this consent, for instance, to be involved or to be considered for clinical research, but that consent is and should be dynamic and can change. And for instance, if your health condition changes or there's a timeline trigger or there's a next of kin action or any number of other things, such as you're going further down the inclusion-exclusion criteria for clinical research. If you happen to be in the work that we've done recently, a child with parental guidance, there's all kinds of nuance and this fairness in ordering is hugely important because you need to know what came before something else. And that's, again, we love that. We love using that. I mentioned the fees, it's for 100% for a read transaction is tremendous. That allows us to very generously allow our users to be able to, anytime they want to, as well as proactively to allow them to see what's happening. And again, we see that as an incredible economically economic advantage for using HCS. And then this idea that you can organize things by topic. You can create a topic, whatever you want to call it. You can send to it whatever payload you want. And I'm going to show an example of this in a minute. And then you can audit it. And again, I'm going to kind of show both of these, in a minute with our live demo or with our demo. So many reasons. We do use all of the Hedera services. We do use Hedera token services. We do have smart contract too. Of course, the transaction service, but really HCS is very central to a lot of our work. So
and Jim, one more question. I'm going to interrupt you one more time because I think it's super relevant. So we have a question. The topics in HCS are publicly visible. I'm curious how you are ensuring privacy in such a scenario. Can you clarify which specific data is being maintained as public?
Yeah, no doubt. In fact, I'm going to show an example very specifically about that. So I think that the short of it is we create topics that make sense to us. Sometimes the topics and the example that you'll see here would be clear text and readable, human readable. Sometimes it's pseudonymized topics, so you can't necessarily tell just what the topic is. But then almost always what we do in terms of the actual payload, the message that's associated to the topic or to the transaction, there is an encrypted payload for the actual content. And optionally, depending on what kind of arrangement we have or what the sensitivity is of the payload, we have some things that can be indexed in English and are human readable. So and I'm going to show an example of that. And then again, to be very clear, we do not put health data, like no patient health data is existing on a public ledger. That will violate all kinds of HIPAA, and certainly doesn't make sense to do so, and at least at this time. Yeah, so this picture basically is just a picture of what I've more or less described, right? We do a lot of work, in our databases, but with this databases, many times what we do is we actually in real time, like in what's called in memory, we reach out using open APIs, the FHIR APIs, the Fast Healthcare Interoperability Resources, to connect to, for instance, an Epic healthcare system, and in memory retrieve or just read the information we need, and then we create a hash of that in real time, and we store the hash. So we don't actually store, even within our encrypted, if you like, protected database, the April platform, we don't actually store the health data itself. The health data itself could well be sitting somewhere here in the ether within an Epic system or whatever system it happens to belong in. So we're very, very kind of conservative about where is the actual data, but we do use quite advanced technologies to make sure that data can be authentic and the transactions or the aggregations and visualizations we do on it make sense without necessarily storing that even within our system, much less on Hedera. So moving on, I'm going to in a second just do a quick demo of what we have built for our public health reporting. But some of you guys may be aware that recently Coinbase showcased us in the work that we've done. And I think they did a really good job highlighting our client from the state of Alabama and the work that we're doing there. But I really wanted to just share this video and just have Dr. McCleskey directly, I guess, speak to us about the value they're seeing. And then that's probably a nice lead into the demo I'm going to show.
Hi, I'm Brandy McCluskey. I'm a forensic pathologist and I serve as an associate coroner medical examiner in Alabama. We're primarily a coroner-based state, and a lot of coroners do not have sophisticated data systems. Many of them are still using paper and pencil, some with Excel spreadsheets. If you go the traditional route, then all of the health statistics take at minimum 6 months, but definitely a year or so before you really can get good aggregate information about vital health statistics. The blockchain technology allowed us to push our information out in real time. It's queryable, it's verified. I know it's secure. Now researchers can access information within a time frame that can actually save lives.
So anyway, I think she did a phenomenal job just explaining the value, and that's really our whole takeaway is there value that somebody like
Jim,
that,
we might have lost you a little bit on your audio.
Oh, can you hear me now? Hello? Can you hear me?
I can hear you. It's just a little soft.
Oh, sorry for that. I didn't mean to do that.
There
Okay.
we go.
Is that better?
Yeah.
Okay, good. Yeah. Anyway, I was just saying that it's great to hear from real clients. Like I mentioned, Dr. McCluskey in this example, she is a forensic pathologist. So somebody who's actually basically is your kind of your real life CSI, literally, doing autopsies and doing all this actual work and just the fact that this kind of system can make a difference for her. So with that being said, this is, I'm just going to just walk through a little bit of a quick demo of what Health Data Explorer looks like. This is more or less what Dr. McCluskey was describing. So let's get into this. So we have this idea that you can create different, on demand, create different, what we call workspaces or demo workspaces, in this case on development, and you can have multiple data sources that you can more or less automatically upload, and we do the mapping so you can use it and get all these analytics. So we're going to go into Jefferson County. You can see there's cases, and you can look directly for a specific case. This is what actually would happen in real life, because many times the pathologists, they either want to go directly to a case because that's what they're working on. For instance, they're working with the district attorney on a case where there's a criminal element, and they want to get information, or they go to the aggregate view for more of an overview of number of transactions and a number of cases. In this case, you can see what we're showing here is what you may see on a death certificate, but there's obviously a lot more. No death certificate looks this rich or provides this much kind of contextual value and contextual data, and you'll see as we go across the tabs how that works out. And then here, this is our first example of what we call this DLT abstraction. So there's a trust button. It says here that the data was last updated on May 8th. So what our clients may do, again, many times they won't, because they know that this works and they see that trust button many times. But if they want to essentially prove it for themselves that the data really is the latest version, the timestamp matches what we're saying, they click on the trust button. And what we're doing basically in real time is taking that encrypted payload of all of this information and comparing it to what is stored on Hedera from May 8th. And this is what it looks like. So this is literally happening in seconds. And what you see here is that we are very quickly comparing that payload, and this is what the payload actually is, this encrypted payload in the memo field, with Hedera's node as well as our own Hedera Explorer, and we're generating this algorithmic score. So effectively, the green button shows up saying verified, but it's really based on us behind the scenes very quickly comparing it across two different explorers, two different independent values, and confirming that that payload is the same payload as what we had on our system. So just clicking through some other information. And then what's interesting here, again, I mentioned this concept of the need in public health and healthcare in general, the data is siloed. And what you'll see here is that actually the data is coming from multiple data sources. We have taken this step behind the scenes to take proprietary data from their internal systems and create JSON files and then CSVs and machine readable files. But even so, there's still 3 different files that go into this, and really always the toxicology information, which comes from autopsies, is different, or in different sources for sure, than the regular death certificate information. So you can see multiple systems, but we're also able to discreetly do this trust, if you like, lookup for the files themselves, not just at the case level. And here's the example. Again, the same kind of concept. I'm not going to go click through the rest. So again, you can kind of create on the fly, create different workspaces, give it descriptions and icons and such. But also, really, this is a big part of our innovation, this idea that you can, as a user, so a user could be a county level administrator or a CDC, public health reporting person, or so on and so forth, can go and upload their data. We have a wizard that we're working on, which is still under development, but essentially allows you to upload your data and matches a template that we're aware of, and then cleans it, makes it machine readable, does a mapping to the fields, for instance, the fire fields that we know should be there, and then basically more or less automatically uploads everything for you. This import sandbox data more or less just demonstrate that or simulates that. And you can see the data has been taken here. This is obviously synthetic data, but it's got all the same functionality that we had for Jefferson County for production is available to this data. The thing that's interesting though here, and I'm going to pause this in a second, what is really interesting is this: we dynamically understand what the data looks like. And you may remember a little bit prior in this video, we had 6 tabs. But for this, we dynamically recognize that the data actually only falls into these 4 different tabs: death certificate, demographics, jurisdiction, and the actual case table view. So that's a very, what we think is a intelligent way of not just, looking at the data, but also dynamically adapting to what it is like and what makes sense for users. We also really like this idea of cross-meshing data, in this case with law enforcement, and showing how data falls into other different views that may be relevant. Of course, adding and removing filters and so on. Settings. Now, the reason why I'm clicking through all this is that you'll see this in a minute. Every one of our clicks is actually stored as an immutable record in our activity log right here, this clicking through that I was doing, the creating of the workspaces. And again, not for every single transaction, but for many of them, we're creating this anchor to Hedera. And you'll see this because that transaction right there is a transaction that's stored. It's an HCS transaction that's stored on Hedera. And again, we can very quickly prove that by going to Hedera Explorer and just showing that. And this question actually, or this very much describes visually what I was explaining, which is what we choose to store publicly. So for this example, we have been quite verbose. So we're putting things such as the email address of the user and what the topic name is and so on and so forth. It's really for demonstration purposes. We wouldn't typically put this much information, but the key thing always though is that it's up to us, and we choose to put out there, and almost always we have an encrypted payload, but also almost always we put something in there that can be tracked transparently because it is benign and it's not sensitive and it cannot be de-engineered. So this is the power of HCS, this ability for us to put the information that we think makes sense for our use case, and we do that regularly with from client to client, application to application, and different use cases. All right, and that's it. That's really kind of the end of my demo, and hopefully that was interesting. And yeah, well, there we go. And just
Thank
a quick,
you, Jim.
yeah, just a quick reference about us, Zenobia, just in case people don't know, Acoer.com. That's what our team looks like. This is what we do. And lots of references, the Coinbase articles I described as well. That's all I got for you.
And definitely, I would encourage folks to go check out the site and look at some of the tools. Jim, I know we have a couple questions. Hopefully you have a few minutes to stay on here. Someone asked about, are there any efforts being made to put research, trial data, or other outcomes onto blockchains so that anyone can analyze the data for themselves and that it is not being sort of gate kept by, only specific entities?
I think the answer is yes. There are definitely efforts, and we're part of it. We're doing some work, as some of you guys may know, within pediatric cancer clinical research with Health Ready. There's some work with another entity called CureChain and some other clinical research partners. To be clear, though, this is a quite tricky space. Really putting the actual clinical data on the chain is not going to happen. There's many reasons for that, at least for the time being. All kinds of things from competitive reasons, privacy reasons, and ownership reasons and things like this. So really, it's more this concept of, can we put, or are we actively working on putting references that allow collaboration on clinical research in an ethical way that really, from our perspective at least, allow the actual owners of the data, and the owners are really individuals, like people like us, Zenobia, Jim and Zenobia and so on, to also have a stake in this process, because that currently just doesn't happen, right? It's many times, in fact, you're signing up for these kind of things without really understanding what you're signing up for. The data sharing kind of tends to be posthumous. I'm being a little bit facetious, but it's, you sign something and maybe months or years later, your data is being shared. There are intermediaries, companies that are aggregators that really, that's their cash cow business. So everybody in the rudder makes money off of your data, but you don't even know about it. So that, to us, that's just dead wrong. That's not the way it should be. There are now some laws, such as the Cures Act, that at least help for accountability on this and give you some information or rather some empowerment as an individual to say, look, this is my data. I want to retrieve it. I want to choose between my share. So blockchain really can be a big part of that. But I just don't want to be naive about this, that right now, this kind of clinical research data sharing, I think it's very much in its infancy. There are not that many examples of it. I know there are some folks doing some big kind of initiatives around cancer specifically that are working on this, but really it's early days when it comes to this idea of a more democratized sharing and more accountable sharing.
All right, and then one last question before we let you go. So the topics in HCS are publicly visible, and this may require a little more explanation, Jim. I'm curious how you are ensuring privacy in such a scenario. Can you kindly clarify which specific data is being maintained as public? And if someone were to manipulate the data within the central database, would that also impact what was presented within a topic message?
Yeah, so that one needs to be unraveled a little bit. So first things first, what we choose, and I showed the example, what we choose to put out into an HCS topic or associated transactions is very much, I would say, what amounts to pseudonymized payload. It's really a pseudonymized payload. So, and why do we do it? Is because we want to show the traceability, right? That is very important to us. That is one way of, kind of being more ethical and more accountable. However, we're also very conservative about, certainly things like HIPAA compliance, but also beyond that, data that can be de-engineered through this public modality. So all to say, for our production systems, And again, I may have did show the payload that we do for our public health reporting, and the entire payload was anonymized. There was nothing that, and all of it is done. We do one-way hashing for this, so you cannot de-engineer that one-way hashing to go back to our data kind of manifestation, which even then is an encrypted payload. So that there's a number of things that we do, and we also, and this is a bigger topic, we also do a rolling hash where we basically look at the preceding hash and the subsequent hash of a transaction. So even if that's broken, I mean, that's more or less like the idea of a blockchain, but it's hash, it's a running hash that we generate ourselves with a one-time key. So there's a lot of things we're doing to ensure that you cannot de-engineer, or very quickly we would get notifications on the sequence breaking. So that's kind of what we do in terms of really kind of this bigger picture, if you like. I think it's a little bit it's evolving. It's the way I would think about it. Right now, and we're trying as much as we can to provide things that are indexable, and allow some kind of breadcrumbing, and allow us publicly to be able to maybe at some point have have something that amounts to maybe like a marketplace, or share, or allowing individuals to kind of know what's being shared and how, but being conservative about about what we're doing. I don't know if that answered the question. I know it's a little bit vague about it, but and then could you also repeat the second part, because I want to make sure I answer that specifically as well.
Yes, the second part was, what would happen if someone were to manipulate the data within the central database? Would that manipulation impact the payload presented within a topic message?
Yes, that's a really good question. So if somebody, and this is difficult, right? Because like I described to you, the way we work, at least the majority of our use cases, we do an in-memory or in-flight calculation of a hash. So we may not know, and often wouldn't know, for instance, if somebody went into like an Epic server and either maliciously or inadvertently created bad data, right? Let's just call it that, right? We really wouldn't know that because we don't have access to those systems in many cases. We do in the case of clients such as State of Alabama, because we're obviously working with them directly on a number of related initiatives, but even so, their original data source is not our data source, right? We're kind of doing this API to API kind of machine to machine secure pipeline communications with them, but we're not at the level of the input or the data capture and input capture. So all to say, if we did know about it, and that's a big if, what we would do is we have triggers to immediately recalculate the hash, because that's really the way our systems work. And then if we recalculate the hash and we realize that there's an error or there's a mismatch, then we would go in and restamp that. Well, so we would go back and have offline conversations or communications with our client, but we would regenerate the hash and put that out there as an amended entry. So we wouldn't show as example, like for instance, going back to the prior example, the May 5th data stamp would have a new data stamp that reflects this new hash. So, and that's something that we do regularly anyway, because the data changes for good reasons, because there's updates on the backend data source, and we have like a watch folder or really an API, kind of listening API that looks for changes. But all that is really within our regular workflow, as opposed to somebody maliciously changing data. So sorry, it was kind of a scenic answer to say that if we know that there's been data changes maliciously, yes, we would absolutely take action. But many times we may not know it unless there's some kind of an offline trigger.
Got it. Well, thank you, Jim. Any last thoughts before we wrap up here today?
I think I'm very optimistic, Zenobia, that there's a bigger and also broader understanding of DLT, and I would say really Hedera specifically, within and for the healthcare space. I'm seeing it, again, knock on wood, people are reaching out to us from all kinds of places, really around the world, actually, on, this is kind of interesting. Is this something that we could use to build from? And I love that, because obviously we cannot, nor are planning to build every solution that there is. That makes no sense. That's not innovation. But we believe that we can help, whether it's just through our work or whether it's through our platform and technologies. We can help accelerate other people's solutions, as well as keep extending our own. So I'm seeing evidence of that. I'm really optimistic. I think just the fact that we're on this webinar is a positive sign. This Lehman Bird, Dr. Bird is coming to Atlanta, and we'll be talking about practical uses of blockchain, including healthcare. So there's a lot of signs that slowly that there's a recognition that technology at Hedera can be used, embedded, maybe the way we do it for doing these stodgy kind of solutions, but actually it makes sense. So
yeah,
that's
indeed,
what missing.
Yeah, our hope is that, it underpins many of the things that we interact with on a daily basis, even if we, or maybe, hopefully with us not even knowing about it.
Exactly.
Well, thank you, Jim, for sharing your time and your wisdom. And we look forward to keeping up with you on all things healthcare related and Acoer related.
Yeah, thank you, Zenobia. I appreciate it. And thank you, Hedera communities. It's always good to be connected.
All right. Thanks, everyone. Have a great one.